How does the physical state, particle size, of a toxicant influence its absorption and toxicity? Smaller particles have greater surface area, allowing more rapid absorption and deeper tissue penetration. For example, fine dusts of zinc phosphide, a rodenticide, or Greek letter alpha-naphthalthioyri, and an hematoxicant, can irritate the respiratory or gastric mucosa more intensely, leading to faster systemic effects. Inhaled nanoparticles can reach alveoli and cross into blood circulation, unlike larger ones that may settle harmlessly in the upper airways. Why is it risky to use expired or improperly stored pesticides in veterinary practice? Decomposition of active ingredients over time may form more toxic byproducts. A classic example is diazinon, which breaks down into highly toxic compounds like tetraethyl pyrophosphate, or isodiazinon under storage, especially in heat or alkaline conditions. A tragic case involved the death of 81 lambs after being dipped in a 15-year-old diazinon-based solution that had formed lethaloxan derivatives and TEP. How does the conversion of triclosan into diclovus increase its toxicity? Triclosan, an organophosphate insecticide used in pets, converts into diclovus in alkaline environments. Diclovus is significantly more toxic, 8-fold lower oral LD in rats. Thus, if triclosan powder is mixed with alkaline water and stored, its conversion increases the risk of acute toxicity, especially in sensitive animals like cats or small breeds. What role do formulation additives, for example, surfactants or solvents, play in modifying toxicity? In some cases, the additives are more toxic than the active ingredient. For example, Roundup herbicide contains glyphosate, relatively non-toxic, but also polyoxyethyleneamine, POEA, a surfactant causing oral ulceration, diarrhea, and systemic depression in animals ingesting treated grass. Solvents in pour-on pesticides can facilitate transdermal absorption, leading to neurotoxicity, for example, with organophosphates in cats. How does temperature affect the pharmacodynamics of toxins like nitrophenols and Greek letter alpha-chlorelose? At high temperatures, nitrophenols, used in herbicides and insecticides, become more toxic due to their ability to uncouple oxidative phosphorylation, producing excessive body heat. Conversely, Greek letter alpha-chlorelose is more toxic in cold environments, as it depresses thermoregulatory centers in the hypothalamus, leading to hypothermia and potentially fatal outcomes, especially in cats and birds. How do dietary trace elements modulate the toxicity of heavy metals like copper and molybdenum? Sulfur and molybdenum form complexes with copper in the gut, limiting its absorption. Diets low in these elements predispose sheep to copper toxicosis. On the flip side, copper-deficient diets heighten molybdenum toxicity, molybdenosis, characterized by anemia, weight loss, and reproductive issues. Thus, balance is key. Both deficiency and excess can trigger disease. Why are sulfur amino acids and antioxidants crucial for xenobiotic detoxification? Sulfur amino acids like methionine and cysteine are precursors for glutathione, GSH, a central molecule in detoxification. Deficiency reduces GSH availability, increasing vulnerability to toxins like acetaminophen, aflatoxin B1, or nitrites. Selenium, vitamin E, and vitamin C act as synergistic antioxidants. For example, selenium-deficient chicks have higher mortality when exposed to paraquat, a redox cycling herbicide. How do vitamin E and polyunsaturated fatty acid, PUFA, levels affect iron toxicity in piglets? Vitamin E stabilizes cell membranes against oxidative damage, especially in PUFA-rich environments. When sows are fed diets high in PUFAs but low in vitamin E, piglets injected with iron, routine practice to prevent anemia, develop fatal hepatic necrosis due to unchecked lipid peroxidation. Supplementing vitamin E in such sows prevents this cascade of oxidative damage. What is the mechanism of paraquat-induced oxidative injury and how does selenium intervene? Paraquat undergoes redox cycling in cells, generating superoxide radicals that damage lungs, kidneys, and liver. Selenium, as a cofactor of GSH peroxidase, reduces hydrogen peroxide and lipid peroxides, limiting tissue damage. Experimental studies show selenium-supplemented chicks or rodents survive better after paraquat exposure. Why do parenteral routes often produce more severe toxic effects than oral exposure? Intravenous or intramuscular administration bypasses first-pass metabolism, delivering the full toxic load into systemic circulation. For example, pyrethroids are largely hydrolyzed in the gut when ingested, making oral exposure relatively safe in mammals. However, dermal or IV exposure bypasses detoxification, posing a greater risk, especially in cats who lack hepatic esterases. How does first-pass metabolism influence the safety of certain insecticides like pyrethrins? Pyrethrins are esterified compounds that are efficiently hydrolyzed by esterases in the GI tract and liver. This reduces their systemic availability and toxicity. But fish, which lack such efficient systems and absorb via gills, are highly susceptible. LD Phytratus, 10 gl. This showcases how metabolism differs across species and routes. What is the significance of enzyme inducers in veterinary toxicology? Enzyme inducers are pregulate phase I and phase II enzymes, accelerating detoxification or bioactivation. Phenobarbital induces CYP2B and CYP3A, aiding in detoxifying warfarin or pyrethroids. However, it also increases conversion of protoxicants like diazinon to diazoxin, exacerbating toxicity. Induction may last weeks after stopping the drug, as seen with barbiturate-treated dogs. How do enzyme inducers affect animals exposed to organophosphates like diazinon? Diazinon must be bioactivated to diazoxin to exert toxicity. In calves pre-treated with dieldrin or PB, this bioactivation is increased, leading to exaggerated cholinergic signs, reduced cholinesterase activity, and higher mortality. Simultaneously, detoxifying esterases may not keep up, tipping the balance toward toxicity. Can enzyme inducers ever protect against poisoning? Yes, if the parent compound is the primary toxicant. For example, phenobarbital-induced dogs are less susceptible to warfarin because CYP2C enzymes rapidly convert it into inactive metabolites. Similarly, increased phase II conjugation, for example, by GSTs or UGTs, reduces susceptibility to aflatoxins or NSAIDs in induced animals. What are enzyme inhibitors and when are they beneficial in toxicology? Enzyme inhibitors block specific metabolic pathways. In acetaminophen toxicity, cimetidine, a CYP inhibitor, prevents the formation of NAPQI, a hepatotoxic metabolite. In ethylene glycol poisoning, 4-methylpyrazole blocks alcohol dehydrogenase, preventing conversion to nephrotoxic oxalate crystals. Inhibitors are thus valuable antidotes in certain poisonings. How does drug interaction between monensin and shyamulin cause toxicity in pigs? Monensin is detoxified by CYP3A enzymes. Shyamulin, a CYP3A inhibitor, blocks this process, causing monensin accumulation, leading to myocardial degeneration, skeletal muscle necrosis, and death. Similar interactions occur with erythromycin, spiramycin, and other macrolides, especially concerning in intensive poultry and swine farms. What are metabolic intermediate complexes and how do they affect enzyme function? Some drugs form stable complexes with CYP enzymes, especially CYP3A, leading to long-term inhibition. Shyamulin and erythromycin undergo endalkylation. Nitroso intermediates tightly bind CYP-hymirin an inactive enzyme. This hampers metabolism of other drugs like monensin or corticosteroids, intensifying adverse effects. What happens when P-glycoproteins are inhibited or genetically absent? PGP pumps xenobiotics out of the brain and other sensitive tissues. Inhibition, by ketoconazole or macrolides, or genetic mutations, as in MDR1 collies, allows drugs like ivermectin, loperamide, or vincristine to accumulate in the CNS, causing tremors, sedation, or seizures. These dogs must avoid PGP substrates. Why is protein binding displacement a concern in drug-drug interactions? Many toxicants, for example, warfarin, are protein-bound. Drugs like NSAIDs or sulfonamides can displace them from albumin, increasing the free, active, fraction. For instance, a dog on warfarin and phenylbutazone may suddenly exhibit bleeding due to elevated unbound warfarin, requiring careful dosage adjustments or avoidance of combination therapy. How do receptor-level drug interactions exacerbate toxicity? Receptor-level synergy can be dangerous. Neuromuscular blockers like succinylcholine amplify organophosphate toxicity by stimulating nicotinic receptors. On the flip side, atropine, a muscarinic blocker, is a key antidote, competitively inhibiting overstimulation by acetylcholine in organophosphate or carbamate poisoning.